Welcome to Profits in Practice, the podcast where medicine meets money. Hosted by myself, Sarah Webb, Managing Director of Webb CFO, and financial strategist for physicians. We break down the numbers, decode the tax code, and help doctors build lasting wealth, one episode at a time. This episode is powered by the Specialty Healthcare Consortium. Dr. Cromie, thank you for joining us today.
Thank you for having me.
Well, I wanted to spend some time with you talking about your marketing. I feel like from afar, I watch a lot of what you're doing and you do a lot of different things. And so wanted to share with our audience what's working for you now, what maybe hasn't worked in the past, but maybe just tell us a little bit about your practice to start with.
Well, Chattanooga Allergy Clinic was established in 1975 by the founder, Dr. Kaplan. I joined in 2000, and at the time, he was a single practitioner. We had one office, 5 employees, and now we have 8 offices, 150 employees, 16 providers. So we've had a huge amount of growth, and I blame a lot of it on marketing.
Well, that's good. What was the marketing like when you arrived?
Well, when I arrived, we didn't have any marketing, really.
Okay.
He didn't believe in ads. I wanted to do some marketing. It's like, Mark, only ambulance chasers will do that. And we're not going to be on the back of a phone book or anything like that. And I finally talked him into doing it. I got on the first TV show, Ask the Doctor. I did answered questions off the air. And then I began going every month on the show.
Okay.
And before you know it, then we started advertising with the TV station. And now, when you think about allergies in Chattanooga, you think about Chattanooga Allergy Clinic.
Yeah. So you became a TV personality to start with.
TV personality, and we've marketed our brand, and we have the awareness of the community. When they think of allergies, they think of us. And it really does have a lot to do with not only taking good care of the patients, but also marketing. You've got to get your name out there. And when people are thinking about allergies, you want them to think about you.
Yeah. Well, what are some of the differences? So you went on air, and then how has that strategy changed over time? Like you're in much more of a digital space now.
We are, and we do a lot of digital stuff now. We have over 2.5 million Facebook, hits a year or visits. We do online ads, Instagram, all these things. Okay.
And you do all of that, or you have a team?
No, I have a team. I have a whole marketing team that does it because I don't understand any of it. When they tell me about your Google power here or whatever, I don't understand it.
Okay.
So when I first started, we had the idea that go to the physician. Okay.
Yes.
Your referral base initially was your primary care doctor, the pediatrician, the ENT that was sending them for recurrent ear infections, the allergy tested, even the pulmonologist that was dealing with asthma. And so I hit on those topics. I would go see the doctors, bring them lunch, talk about Chattanooga Allergy Clinic, or I'd talk about the latest drug that the pharmaceutical company was sending me out to. One year I did 50 talks. So I was busy, but I was promoting not only their drugs, but also myself and the practice. So I used that. And then we had a rep come to us who was a retired respiratory allergy rep, and we convinced him to work for us. And we had the first direct-to-physician marketing in the area. So he would go to the doctors, and he would give them brochures, or he would go to the front desk staff and say, if you got a kid that has recurrent ear infections, sinus infections, they need to be allergy tested, send them to Chattanooga Allergy Clinic. And so it snowballed.
Well, and he understood how that whole process worked, kind of being on the other side.
He was educated in the disease states, and then he knew us, and he knew what needed to be referred. It's important to find out what you want referred to you. Okay. So,
and then what about the other people on the staff, the other team members?
Well, the other team members, now that I was our full-time marketing director, actually his son was a patient of mine with severe peanut allergy.
Okay.
So he had an idea of the disease severity and of the allergy market, and he was working for another company. And so we brought him on to be a full-time. He looks at our ads, he looks at our budget, he determines how much we're going to spend on TV, radio, billboards, and all the other digital stuff.
Okay. So you're in lots of different channels.
We're in lots of different channels. In addition to that, we are involved in the community. And that's something I think is most important, is spending time in the community, giving to the children's hospitals, sponsoring the heart ball, the lung ball, the golf.
The little league team, right?
All of it. Every little league team in town has my emblem on the back, all right? They know what Chattanooga Allergy Clinic looks like because we become the market leaders. But by giving back to the community, they give back to you. But, so you want to get out there, you want to have your brand awareness at a peak so that when people think about allergies, and in the South or in Chattanooga, everybody thinks about allergies, especially during the spring when the pollen count is so high. So we even decided to, we make calendars every year. So in Christmas, we make 5,000 calendars and give them out to our patients, but also our referral base.
Okay.
So at the cover of it, it says Sneezin's Greetings.
Oh,
I mean,
goodness.
so I know
So
it's
corny. Yes,
You know what?
it is.
They
But
love it. Every year, we'll get a call from a receptionist at a primary care doctor office say, hey, I never got my calendar this year. I mean, so it's become like a hot topic. So that's just little things that we do.
That's funny. How does your staff handle the new patient process? Like, what does that look like? Are they calling? Are they calling from their phone? I think we had talked about that.
Yeah. So originally, when we first started, 70% of our referrals were from doctors that were sending over physician referrals. Now that has changed. It's about a third. A third is word of mouth.
Okay.
I've been doing this long enough now. I'm taking care of not only the mom, but her child. I probably saw her grandmother earlier. I feel really old, but I'm privileged to do that. That is the greatest, love you can get, is when somebody allows you to take care of their family, generations of it. So with allergies, it's from the womb to the tomb, is what I say. We see all ages, whether it's grandma with a aspirin desensitization, or you got the infant that's got milk protein intolerance, or some food allergy. So we're seeing them all ages. So that's great. We love to see that. But the other thing, we've got this thing called Dear Doc, which when somebody goes on our website, it's AI generated, that even if it's in the middle of the night, if they're looking at allergies, it'll prompt them with questions that we've already.
Like a decision tree?
Yes.
Okay.
And then if they want to make an appointment the next morning, we get a text, email, we'll call them and set it up. But if it's during work hours, we have an instant gratification thing. If they are on that site and they're putting information, it will immediately call one of our receptionists in our team to scheduling, and they'll talk to the patient right away.
Okay.
So we grab them while they're interested. They don't have time to run away.
Well,
and find them.
I find that I delay stuff, right? Like I'm researching it, and then I'm like, oh, I'll get to that later. And I use an app on my phone to give myself a reminder, but sometimes I just ignore this. So it's great to get that live person right then, and really help them get through whatever their pain point is. That receptionist can triage, like, how quickly do they need to be seen, or maybe which provider is best for what they're looking at.
And a lot of times they'll have, a preference for a provider. Sure. And if they would just want first available, then we'll do that too. And then once they get their feet in the door, that's when it starts. So I always tell that my girls at the front desk, they're the first face that they see.
Yes.
And they need to be the one that they remember. And so we treat them with kindness. Like I said, we do the Ritz-Carlton, Chick-fil-A, the patient / customer is always right, and it's our pleasure to serve you, because we know you can go somewhere else to get your healthcare needs. So we try to instill that in all our employees, and we treat everybody like family. I think that's part of what's been our growth has been so significant, is that we do care about the patient. So if you're on allergy shots, you're getting a shot every week, every 2 weeks, you're there for 3 to 5 years. That shot girl. Jenna in the shot room is your girl, okay? You know about her family, and they know the patients. And so if there's an issue, they're able to get one of us, or they're able to make an appointment if they're having an exacerbation of something. So it's been a huge, it just grows the brand by doing what is the best thing you can do. And I think I told you this before. When I was a kid, I had allergy shots. Dr. Scott Carroll, who started the Atlanta Allergy Clinic, was my allergist, and I always wanted to be an allergist. But part of it was I saw him in the way he interacted with kids and my mom. I was an only child of an Italian family that had terrible allergies, so she wanted to put me in a bubble. I was like the John Travolta bubble baby, okay? And so he reassured her through allergy shots and medicines. I was able to live
a full life.
Full life. And so it changed me, and I wanted to be like him. And so, it's been a blessing. So it's beautiful when you enjoy what you do. It doesn't seem like you're working.
Yeah. Well, I'm going to dive into some finance questions, because I'm always like, I see the budgets and I'm like, what is the ROI on this marketing? And you talked about looking at metrics. Do you ask all of your patients kind of how they came into the office?
I do. And one of the first questions that we have in the new patient form is, how did you find out about us?
Okay.
Whether it's word of mouth or it's a family member, but a lot of times it's online ads. It can be anything from, Instagram, Facebook. So we put stuff in our ads too that are family oriented, like dealing with children, dealing with dogs, all the stuff in Chattanooga that is allergenic. We're in a scenic city.
Yeah.
So we have huge pollen counts. We're usually in the top 5 in the nation when it comes to allergy capitals.
I didn't know you got to claim that.
Oh yeah. We are very proud of it. It's us, Knoxville, other places. But so we always ask the patient how they came to find us. And so it's interesting when you talk about return on investment. In the old days, it was being on TV. Okay, that was a big deal. I could tell how my marketing was doing by how many people I saw in Publix. I said, "Hey, Dr. Cromie, how are you?"
Okay.
And they're like, "Oh, I've seen you on TV." But that familiarity is what drives people also.
Yeah.
Obviously you have the good reputation, you have the good job, but if they feel like they know you because they've seen you on TV, then, it kind of makes them feel more comfortable to come in, or they want to see you. So that's important. The other thing is we're not spending as much high dollar marketing on like billboards. TV ads are still there because I like to be on TV, but a lot of it's going to this other routes. Matter of fact, I told you earlier, I saw a patient a couple weeks ago that said, I asked them how they came in. They said, "I saw your billboard." And I didn't have the heart to tell them that it was the other group's billboard. But we had done such a good job of
you have the familiarity.
The familiarity. They saw allergy. They just thought, hey, that's got to be Chattanooga Allergy Clinic. So
that's fun.
So it can be a waste of money for some things. But I do believe that the digital era is where the money's going. And it's where, and because everybody has their phone. They make 60% of their appointments, on their handheld device. So.
Absolutely. Yeah. It's right there. It's easy. But when you talk about being familiar, your staff comes across as familiar. They're being featured in your video and your content too. It makes me feel like I know the whole team, right?
Exactly.
Like, we're all in this together, and being a patient is chronic, right? You're there often. And so being part of the family for sure.
Yes.
If you were to encourage a physician that was starting to dip their toe into marketing, what would you advise them to do?
I would say get involved in the community. I mean, join a civic organization, be out there so that people see you and know you. I mean, when I joined our country club, early on, I was like, I don't know if I can afford this, Dr. Kaplan. He said, it will pay 10 times, Mark, whatever you put into it, because everybody there knows you and they're going to want to see you. Yeah. So getting out there, but also I would say marketing, get out there, get your brand out there so that people know who you are. Particularly, it just depends upon your market. If you have a lot of competition, it's going to be hard.
Right.
So that's where you go to the primary care doctors. You've got a new physician in town that just came out of their residency and they're starting. Befriend them, bring them lunch, tell them about your practice. And those relationships are what will grow their practice. And I totally believe in that.
Yeah. I mean, even from a professional standpoint, I have a network of people. Do you need an insurance agent, or do you need this type of person? And, I always want a referral from someone that I actually know. And that's what you're doing. That's what the physicians are doing, of like, I do know Dr. Cromie, his team is great, and they are confident that you're going to take good care of them. Yeah. Absolutely. Well, thank you for joining us. It's good to always talk about marketing, and you're definitely enthusiastic about it, but it's been great for your patients, right? They're seeing you, they're getting relief, but also your team as well.
Yes, I'm very blessed to have a good team and blessed to enjoy taking care of these patients.
Yeah, absolutely. Thanks for joining us.
Thank you.
Thanks for tuning in to Profits in Practice. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with a fellow physician. Your financial wellness is just as important as your patient's health, and we're here to help you thrive. Connect with us via our website, webcfo.com, and connect with our guest at sh-consortium.com to find out more about the consortium.